dominant showcase of support that brought back good times. Was seeing familiar faces, not just teammates, but personnel around the organization or the facility, man. But dog, Greg, man, that was
Healing and just together. So I am Delshana Rose Dixon, a licensed therapist, public health professional, and the founder of a nonprofit called Purple Rose Petals. And I'm so excited to be here with you all.
Hello, everyone. You met me in the beginning, but I'm Lakeisha Harris. I'm a licensed mental health therapist located here in Charlotte, North Carolina, originally from Boston, though. And I have a private practice as well as I run and operate the Healing is Power Center, which is a wellness center here in Charlotte, North Carolina. Excited for you guys to be here.
I am excited for you guys to be here as well. Um, and I am Linda Solomon. I am a retired educator. Um, I have a background in psychology and health counseling, restorative justice, and Sarah Bona healing circles, which happen to be African-centered healing circles. And so again, I'm pleased to be here, and I'm thrilled that everyone has chosen to be here with us this evening.
All right. My name is Dr. Willa Thompson. I am a board certified psychiatric nurse practitioner. I have been working in psychiatry over 20 years. I too have a private practice called Mindcrafters in Gretna, Louisiana. And I also teach mental health at one of the local community colleges. And thank you guys for tuning in and listening to us.
Mhm.
All right, the agreements, let's get into it. We have a couple of agreements that we would like you guys to adhere to. First, when speaking, we would like you to speak from the heart, okay? When listening, we want you to listen with an open mind and an open heart, right? When speaking, we want you to use I statements. We want you to respect the speaking order and honor confidentiality, meaning what's going on in this discussion should stay in this discussion. All right?
Yes.
Technical agreements. When you're when you're in here, we want you to keep your camera on, but please mute your microphone. I'll say that again. Please mute your microphone. Feel free to show nonverbal feedback to the speaker to emphasize connection and be mindful of distractions. Okay? And that's it. All right. We have one disclaimer. All right. While the founding members are licensed and experienced clinicians and or healthcare professionals, the healing table is not a substitute for professional counseling, therapy, or medical treatment. Remember, reaching out for help is an act of strength and self-care.
Mm-hmm.
All right, so awesome. So before we start talking, I tend to be one of those community, and I think our speaker is one too. But I really do like to get everyone engaged and feel like you are a part. So not just listen, this is a learning collaborative. So this is a time that we would love to know what brought you here this evening. What are some of your expectations and or what would you like to leave with? Now, I don't expect everyone to get off mic and talk, but you can definitely put it in the chat. And if you maybe two or three of you want to get on and kind of share what brought you here this evening and or what do you hope to leave with? And you can unmute yourself and speak. Let's see. Or I tend to be one who, if you do not join the community, I will pull you into the community. So somebody can volunteer, or I'll be voluntold. It is totally up to you. So who would
I'll
like to
go.
who would like to volunteer?
I'll go. It's
Volunteer.
Brittany.
All right. Okay, so I have two people. Wonderful. I have Brittany and is it Ariana?
Ariana.
Okay, awesome. So Brittany, go first and then Ariana. Thank you both.
What I want to get out of this is to see if anyone has similar issues when it comes to anxiety, because that's a big thing for me. And the way that it developed is through trauma. I'm not sure how, but it's like when I lost my dad, it's like anxiety. My anxiety got enhanced and it became like social anxiety, severe anxiety, and sometimes it's hard for me to calm down from it.
Okay.
It used to cause panic attacks and stuff like that.
Hmm.
So I'm just, but now it's under control, but it's just sometimes it can get out of hand depending on the situation.
Okay. Awesome. So thank you so much for sharing that. And that's the wonderful thing about community and knowing that you're not alone in your struggles. Like one of the benefits and one of the avenues of healing is normalization, right? Awesome. So thank you so much for sharing, Brittany.
Mhm.
Ariana, what did you want to share? What brought you here today, or what do you expect?
Well, Shauna invited me, so I joined, and then you got me with the volunteer. I hate people got to be volunteer, so I wanted to just hop in and save y'all.
Thank you.
Hey, well, thank you, thank you.
No problem. But what made me join when she dropped it in our group chat was because I literally was just telling a friend today how I want to work more on just really applying the whole, I guess, scripture of how worrying doesn't add like a moment to our life. And to me, that goes hand in hand with the anxiety. And I think there's years where I do really good about like not worrying or being anxious about anything. But then there's other years where I'm like waking up out of my sleep and my chest is racing because of whatever reason. So I'm just working on trying not to give anxiety or worry like not another space or moment in my life. So this was a very timely call to be on.
Awesome. Thank you. So thank you for sharing that, and thank you for joining us today. Anyone else would like to share either in the chat or turn off your mute and share what brought you here
Sure.
today?
Hi, my name is Jamila. I was invited by Shauna, and of course, wanted to support her in her speaking endeavors. But I also do want to be more intentional, especially during this time, about building community. In a different, unique ways, where you know, to also learn different methods and like kind of build different ideas of how to deal with like everyday struggles with anxiety, just like it is pretty much.
Absolutely awesome. Thank you so much for sharing that, Jamila. And welcome, welcome, welcome to everyone once again. Um, we're gonna move on.
Okay, before we move on, I did see that Tatiana put in the chat, so I just wanted to acknowledge what she said. She said, Miss Linda brought her here. She said everything she puts together is always amazing. She also said that she still struggles with anxiety and would like to continue to learn on how best to cope through it and not letting it affect her, her children, and her marriage and her relationships. Thank you for sharing that, Tatiana.
Thank you.
Awesome. Awesome.
Of course. All right, so we are going to move on to our guest speaker. I wanted to quickly introduce her. Her name is Renee Anaru. She's a licensed clinical social worker, certified herbalist, speaker, consultant, and the founder of Core Psychotherapy LCSW, which is a private practice providing culturally informed mental health treatments to individuals ages 14 to 40. With over 10 years of clinical experience, Renee specializes in supporting clients navigating anxiety, depression, emotional dysregulation, trauma, PTSD, grief, and related mental health concerns. As a Caribbean American woman, she brings a deep understanding of the impact of culture, identity, and community on the healing journey. Her therapeutic approach is warm, grounded, and rooted in self-compassion, creating a space where clients feel safe, seen, and empowered. In addition to psychotherapy, Renee integrates holistic wellness into her work as a certified herbalist. She offers 100% natural herbal products designed to support mental and emotional well-being. She also provides speaking engagements and consultation services focused on mental health, education, culturally responsive care, and sustainable wellness practices. So please, please help me in welcoming Renee tonight to the healing table.
Woo!
Welcome, welcome, welcome. Excited
Welcome,
to
welcome,
have
welcome.
you.
Thank you, Shauna, for that beautiful introduction. I
Sure.
appreciate everyone being here, and I appreciate being a presenter on such an important topic. And I feel like, again, Shauna already spoke so much about what I do, who I am. But one piece that I didn't share with her that I will gladly share with you guys is why this topic actually means so much to me and why it is a pretty important role in the work that I do as a therapist. Okay, so when it comes to anxiety, just a quick little disclaimer, or not disclaimer, but I guess self-disclosure about me. So why is this topic important and special to me? So I actually have anxiety myself as a mental health therapist. Okay. And so it's anxiety can be hereditary, can run in the family. And so that's something that I have seen with my family, and it's something that I experienced personally. So in my early 20s, I experienced my first panic attack. I was in college. I was late for my grad school class, and the professor was very like, if you're not on time, you're not going to pass my class. You may not, like, he like scared me, right? So I'm now experiencing a panic attack at maybe like the age of 21, 22. I've had another one maybe a year or two after that, and it's kind of unfolded and unraveled over years. That's gotten me to this point where, again, I use my lived experience, but also my clinical and professional experience to help educate my clients and the public on anxiety, what it looks like, and how we can best manage it, which basically leads us to this topic for today. Okay.
Awesome.
So again, Shauna did a very beautiful job introducing me. So we are just going to get straight into the presentation. Give me 1 second to share my screen. So I do want to make sure everyone's seeing my screen.
Yes.
Yes. Okay, perfect. Move this over here. Okay, so understanding anxiety, the brain, the body, and the tools to heal. Right. So I'm going to skip over most of this because Shauna already included it in the introduction. But yes, I am a licensed clinical social worker with over 10 years of experience, primarily working with clients when it comes to anxiety, depression, grief, trauma. Again, Shauna listed a lot of these already. I am the founder of Core Psychotherapy, which is a practice that I founded, I want to say about 4 years ago now, where I just kind of realized, you know what, I'm tired of working for other people. I like, the autonomy of working for myself, right? Being able to make my own decisions and things like that. So that's kind of where core psychotherapy came from for me. And I like to, again, provide culturally informed, holistic, and evidence-based care. So I also do have I am a certified clinical anxiety treatment professional as well, which is part of the reason as to why I'm able to provide this presentation to you all tonight. Okay. All right, so the agenda really quickly, what we're going to go over today. So anxiety 101. So we want to start with the basics. What is anxiety? Why does it happen? Okay. Then how anxiety shows up in the mind, the body, and our behaviors. The neuroscience of anxiety. So that's like the brain. Like, how does the brain operate in a way that it can either cause anxiety or keep anxiety going? Treatment options for anxiety. So whether that's holistic remedies or medical, more prescription remedies. Then we will talk about practical tools you can use today in addition to some of those remedies. And then we'll talk, of course, about some resources and support. Okay. As mentioned, if you can keep your questions, actually write your questions down in the chat. I'm pretty sure they will be monitored. And then we'll make sure when we get to the end, when we do the Q&A, I will make sure to answer everyone's questions. Okay. I'm also trying to keep this a little interactive. It is, what's today? Thursday. We're getting towards the end of the week. I don't know if people are tired. I'm a little tired, but so I want to keep this interactive. So I'm going to be asking questions throughout, especially as someone mentioned earlier, wanting to see if other people can, if she can relate to other people or other people can relate to her. So that might be some of the questions that I ask. Okay. All right. So what is anxiety? Now, I wanted to start with this because I feel like a lot of people have a misperception of what anxiety is, what it looks like, especially with social media these days. Don't even get me started on the miseducation that I see on social media about mental health. That's a topic for another webinar. But for today, the myths of anxiety, that's kind of where I want to start. Okay. So for one, people may think, and I've heard this a lot, that anxiety is a sign of weakness, right? If I can be honest, mental health, therapy, I've heard all of these things are signs of weakness, right? But I do want to say that anxiety is actually a normal brain and body response to a perceived threat, right? So it's not a character flaw, doesn't mean anything's wrong with you. It's a natural response to situations that we may experience, okay? Another myth is that only people with a mental health problem may experience anxiety. This is false, okay? Everyone experiences anxiety to some level, to some extent, right? When we talk about adrenaline, that can look like anxiety as well. It can kind of mirror each other. It's just that anxiety becomes more crucial or like an anxiety disorder when it's chronic or it is disruptive to daily life, okay? You can just snap out of anxiety or like just start to think positive. Like, don't worry, like it's that easy. And it's actually not that easy, okay? That's another kind of myth that's out there, because anxiety actually involves the nervous system and brain chemistry as well. And so it often requires intentional strategies to manage that anxiety. It's not just a 1, 2, 3 quick fix, okay? Avoiding what makes you anxious is the best way to cope. So I'm gonna put like an asterisk, like a star over this one because we're not avoiding. We're gonna get to avoidance in a few slides, but if anybody here feels that whether you experience anxiety or you know people that experience anxiety and they choose, you know, I'm gonna avoid because I don't have to deal with the thing. I'm gonna stop y'all right in y'all tracks. Avoiding anxiety is never the way to go, and I'm going to explain why again in a few slides. Okay. Let's see. Anxiety always shows up as panic or nervousness. So this isn't always necessarily true. It can for a lot of people, but anxiety can also be subtle and it can also look like fatigue, irritability, restlessness, or even physical tension. These can all be different signs of anxiety. Okay. And then medication is the only way to manage anxiety. I've heard things like this as well. Medication is the only way to address mental health needs. This is also not necessarily the only way. Many people may benefit from therapy, lifestyle changes, holistic supports with or without medication. So it kind of just depends. It's not a one size fits all situation. It's very situational and individualized. Okay. So again, anxiety is a normal survival response. We all experience it to some level. It just only becomes a problem when it's chronic, intense, or disrupts your daily life. Okay. And that can be whether it's school, work, socialization, things of that nature. Okay. All right, so how does anxiety show up? So there's several different ways that anxiety can show up, and we're going to talk about all of them. So the mind, the body, and our behaviors, like I mentioned earlier on the first slide. So with the mind, this is more of cognitive processes is what we call it, right? So cognitions, that's the brain, that's the mind, that's our thoughts, right? That's all of that stuff. So what does that look like? A person experiencing anxiety may be overthinking. Maybe they're having racing thoughts. Maybe they are catastrophizing. So what is catastrophizing? So for anyone on the call that's not aware, catastrophizing is, all right, when you think of the word catastrophe, it's like a hurricane or a tornado or something like that, right? Something that's a flood. It's a bad situation. It's like a worst case scenario. We don't want catastrophes to happen, right? So when a person is catastrophizing, that means that they are thinking the worst case scenario. Right? So for example, let's say if a person is applying for a job, right? And so they're sitting in the waiting room, waiting to be seen, and maybe there's a few other people also applying for the same job, and the person is catastrophizing, saying, I'm not qualified, I'm not going to get the job, there are way more qualified people than me, I didn't prepare like they're already thinking I'm not going to get the job, which catastrophizing is, not helpful, because what happens is you're probably going to go into that interview and probably do poorly on that interview because you went in with that negative mindset, with that catastrophizing, anxious mindset, right? So again, catastrophizing is a irrational way of thinking that ends up actually adding to your level of anxiety. Okay. And then there's also potential what if thoughts. What if this happens? What if that happens? Again, these kind of prolong the anxiety. Okay. We also have somatic symptoms. So somatic symptoms are just basically physical symptoms. So the body, right? So if anybody on the call has ever experienced tight chest, like chest tightness, increased heart rate, heart palpitations, sweating, shaking, upset stomach, headaches, fatigue. If anybody and I'll go back to the mind as well, but has anybody experienced any of this stuff? If you have, please write it in the chat, because I feel that a lot of these are very, very common. And a lot of people don't even realize just how common they are, especially because a lot of these symptoms are internal, right? So the minds and the body symptoms, the somatic symptoms are internal. So I could look at a person, they could be, having the increased heart rate and catastrophizing, and I don't even know it. Right? So let me take a look at the chat really quickly. Me, yes, right? So, and if I could be honest, like I'm all about self-disclosure. I'm just because I'm a therapist, I am not, above anybody by no means. I definitely experience increased heart rate, chest tightness. Sometimes I do catastrophize, so I do try to make sure I practice what I preach. So I'm telling you guys not to catastrophize, so I talk myself out of it often. But it's just helpful because I'm aware of these things. So I know how to talk myself out of it, which is why I want to educate you guys on the same topic so you can do the same. Okay. Let's see. All feeling like overheating, right? So a lot of these physical symptoms that we may experience, people could probably experience other physical symptoms as well. This is just a short list that I wanted to give you guys as an example. Behavior, right? So what does that look like for a person experiencing anxiety? So again, avoidance, like I mentioned before, and or procrastination, irritability or shutting down, often seeking reassurance, and control behaviors. If anybody in the chat has also experienced this, you can write this down as well. Okay. Let's see. So what I do want to ask is, when you feel anxious, if anybody on the call experiences anxiety, or if you know people, what tends to show up first? Is it a symptom related to the mind, the cognitions, the thoughts? Is it somatic? Is it physical? Or is it behavioral? What shows up first? Or is it a combination of all three? Is it like simultaneous? Is it just kind of like, a lot happening all at one time?
Somatic.
So I see behavioral, somatic, thank you. Cognitive, I see in the chat. Brain, right? I'm trying to think about, actually, this is a good question for me to answer. Let
So,
me
and I
think,
can
what
share
happens
with
for
you
me?
what people are saying. Brittany
Yes.
says first it's behavioral, and Tatiana says in the brain. Some say overthinking. Zana says overthinking. People are saying that they have experienced a lot of the symptoms, if not all of them, and the nervous system is affected as well. So quite
Yep. And so,
a lot of yeses.
right. And so again, when we talked about relatability, a lot of this is more common than people even realize, right? And so I think for me, it's probably mind and somatic probably come up the first for me, and then behavioral will come after that. Okay. Let's see. So next slide. Common types of anxiety. So this is getting a little bit into in terms of more clinical terms, in terms of diagnoses and things of that nature. And so we have generalized anxiety disorder. So that's basically, I'm not going to go down all of the criteria, but generalized anxiety disorder, if you think about it, it's kind of in the name, it's like general anxiety. So you're not just anxious about work, social crowds. You're kind of, you can experience anxiety around all of these different areas. Okay. There's no stopping where the anxiety goes. It just goes everywhere. Okay. Then we have panic disorder. So panic disorder is basically when a person experiences panic attacks. Okay. I want to quickly add something that I actually spoke about on my social media platforms in regards to panic disorder or panic attacks and anxiety attacks. So I don't know if anybody on this call is aware, but there's actually no real, we're talking about clinical, right? No real definition or such thing as anxiety attacks. When we come to think about what that looks like, it's more so panic attacks. And so like you're probably wondering, well, why, where did this come from? Anxiety attacks, like why do people talk about it? Why is it being used? So it's more of like a pop culture term that, again, social media or, people who might not necessarily be in the mental health field have used often, and it's just kind of stuck. But how I like to still define anxiety attacks is a lesser version of panic, right? So panic attacks. So when you think about panic attacks, a panic attack has a sudden onset. So it just kind of happens very quickly, suddenly, and it's very intense, right? So you're feeling a lot of these somatic symptoms. You are feeling or experiencing a lot of these cognitions or irrational thinking, the catastrophizing and the what if thoughts. And you are, again, heart palpitations, you are shaking, and what usually happens is that it tends to taper off, even though the onset is abrupt. It tapers off depending on the person. Again, this is very individualized. It can be maybe 30 minutes, an hour, 2 hours potentially, right? And you're kind of shutting down. You're not really able to function during this space, okay? Whereas anxiety or an anxiety attack is less intense. So again, we'll be clear, there's no clinical term for anxiety attack, but just for the sake of using the term that's widely used a lot of the time, anxiety attacks are less severe, right? So it's kind of like I feel anxious, but I could probably still, like I'm having an anxiety attack, but I can still talk. Maybe my heart doesn't feel like it's about to, beat out of my chest, right? So again, it's just less intense, okay? Social anxiety, anxiety in social situations, whether it's schools, crowds, gyms, anywhere where there's crowds. And I want to be clear to say that all of these diagnoses are specific to what I mentioned before, if it's negatively interfering with your daily functioning, right? So a person can have anxiety, but not have anxiety disorder, right? If they're having anxiety, but it's not negatively interfering with work, school, relationships, their ability to take care of responsibilities like pay bills and sleep and eat, then they probably don't have an anxiety disorder. Okay, they just have anxiety. So it's really a diagnosis when it's really impeding on your ability to function adequately in life. Okay. Phobias, I'm pretty sure you guys are familiar with phobias. If a person has a phobia of spiders, something like that, it's an intense fear, again, that causes a level of distress higher than the norm. Okay. And then we also have trauma-related anxiety. I know that we did have a individual speak at the beginning of this call saying that after a grief experience, anxiety started to show up for them, right? So that would be kind of trauma-related. Grief can be traumatic, right? And this is more aligned with like PTSD, post-traumatic stress disorder, or some type of traumatic experience. Again, it can be a catastrophe that you experience, and now you experience trauma-related anxiety as a result, okay? So like I said before, many people experience anxiety without actually meeting diagnostic criteria. So you might not be diagnosed with anxiety, but you experience anxiety, if that makes sense. Okay. All right. So now we're going to get into the cycle of anxiety. Okay. Before we do, let me take a sip of water because I'm a talker. I could talk all day. I've been talking all day having sessions. So give me 1 second. Okay, so cycle of anxiety. What typically happens, we're going to start with the circle right here on the top. Okay, I don't know if you guys can see my cursor. So you experience some form of anxiety, right? Whether it's a situation, a conversation, whatever that triggering, anxiety provoking situation is. You perceive that situation to be threatening or dangerous. Okay. Now what happens is you're now going to experience the fight, flight. This graphic only has fight or flight, but there's actually fight, flight, freeze, and fawn. I know a lot of people are not familiar with fawn. We're going to get into all 4 of those. Okay. So basically what this is saying is that people tend to, once you experience or perceive there to be a threat, you're going to react, you're going to respond like all humans will do, right? And so either you flight, so like I'm out of there, like I don't like this thing is too dangerous for me, or it's too threatening for me. I'm leaving, I'm bolting, I'm out of the door, right? Because you don't want to experience that anxiety, so you leave, right? That's flight. Freeze or fight is when you kind of want to go on like defense mode. Like you are trying to figure out a way to resolve that anxiety by confronting it, right? You're really going to address it. You're going to like face it head on, but not always in the most healthy or positive way. Okay, because you're still experiencing that anxiety at the same time. The freeze response is that you are freezing, you are shutting down, you are becoming mute, you are not able to kind of, you're not running or fighting, you're kind of just in this space of, I don't know what to do. Okay. Now, fawn is a fourth one, which is again very less commonly used, but fawn is more of like the people pleasing response. So instead of doing one of the other three, let's say there's a confrontation you're having with someone, right? And so to avoid the confrontation from continuing, you're going to give them what they're looking for, right? Or you're going to say what they're looking for as a way to end the confrontation, which you believe will end your anxiety. Okay. So you're going to respond in one of those ways. Then you're going to experience anxiety relief, but it's going to be short-term anxiety relief. Okay. And I'll explain why in a bit. But then when you're experiencing that short-term anxiety relief, what happens is that the anxiety is actually reinforced and you're going to have long-term anxiety growth as a result. Because what happens is kind of like you're putting a Band-Aid over the situation, right? By doing the fight, flight, freeze, or fawn response, it's like putting on a Band-Aid. You're not actively healing it. It's just kind of covering it for now. But once that Band-Aid comes off, that wound might still be there. Okay. So what we want to do instead is more of this cycle of anxiety. Okay. So we're going to again start at the top. If you guys can see my cursor. So you are confronted with a potentially feared or dangerous situation, right? So again, you perceive it to be threatening or dangerous. You're going to experience a short-term increase in anxiety because you're experiencing that situation. And instead of the fight, flight, freeze, or fawn response, what you're going to do instead is use effective coping skills, which we'll talk about some of these in a few minutes. But when you use these more so effective coping skills, what will happen is you will have more reduced anxiety that's more long-term. And then you're going to have a greater belief in your ability to control responses and control anxiety in the future. So it's not a perpetual cycle anymore. It's not like it's going to keep, this hamster wheel that keeps going. You're kind of taking yourself out of that hamster wheel because instead of, again, using the fight, flight, freeze, or fawn response, you're using more of an effective coping skill to manage that anxiety. And then so therefore the anxiety is not reinforced. It doesn't necessarily continue. Okay, this is all anxiety management here. Okay. All right, next slide. So this is an area that I find that not many people find interesting, at least in my experience, what I've seen, but it's also really important to understand how the brain works, okay? So the neuroscience of anxiety. So there's key brain areas that impact what anxiety or just mental health in general may look like for each person, okay? So we have the amygdala. The amygdala is like the alarm system, okay? So it detects whether there's a threat or danger, whether it's real or perceived. The amygdala is gonna like sound. It's gonna go off, right? Oh, there's a threat. There's some type of dangerous situation. There's a confrontation, right? It's going to sound off that alarm. Now, the amygdala activates that fight, flight, or freeze response, like I mentioned before, or fawn response. And so in anxiety, the amygdala is like overactive. It's like, if you can think of like a hyperactive entity, I can't even think of anything, but just like something that's just like signaling it's going off. That's what's happening when the amygdala is going off in that way when anxiety is occurring. Okay. Now we have the prefrontal cortex, which is responsible for reasoning, logic, and decision making. Okay. So it helps people evaluate whether a threat is real or imagined. So kind of like, again, the amygdala brings up the situation. The prefrontal cortex will help you know, is the situation real? Is it imagined? Is it dangerous? Is it not? Right? And so what it does is that it sends signals to the amygdala. So this is the amygdala. This is the prefrontal cortex. It's sending signals to the amygdala. But what happens is like the amygdala is not listening. It's like, I'm in my, no, like, do not go away. I'm doing my own thing. I see perceived threat and it's overriding the prefrontal cortex. It's overriding that logic and that reason. Okay. Then we have the hippocampus, which the hippocampus stores memories and past experiences. So if a person has a past experience that was threatening for them, the hippocampus helps you to remember that that situation was actually threatening. Okay. So it helps the brain to recognize when a situation is safe versus dangerous. Sometimes what the hippocampus can actually do as well, which isn't always helpful, but it can over associate a current situation with past stress or trauma. So like, for example, let's say if you had a past situation and it was very threatening to you, right? It was traumatic, it was dangerous. And then you have a current situation that may be a little similar. The hippocampus may potentially, not always, but may potentially compare those two situations, and you may over associate that past situation with the current one, even though they're separate situations. Okay, so we really want that prefrontal cortex to kind of like come in and do its job. But how we can do that is with some of the tools to treat the anxiety. Okay. And so, yes, the anxiety equals the amygdala firing faster than the prefrontal cortex can calm it. So again, the prefrontal cortex is trying to do its job, but the amygdala is not allowing it to. Again, if you guys have any questions, please make sure you are putting them in the chat. I know I feel like I'm going a little fast. I'm not sure. But we could circle back to anything that you guys want to know more about. Okay, so treating anxiety. Definitely several ways to do so. Definitely therapy. Of course, I'm a therapist, so I might be a little biased. But if I can be honest with you guys, I feel like everybody could benefit from therapy. Just because, one, we are humans living in the world, and so at some point you might have experienced some level of trauma, stress, financial struggles, relationship issues, family stress, something, right? Not that I wish that on people. I just know that's inevitable in life that we may experience something. That therapy could be helpful. Okay. So again, I'm biased, but I feel like everybody could use it. I'm in therapy myself, again, I self-disclose and I have no shame about it. Okay. So again, therapy can be helpful to learn skills, to help learn how to regulate the nervous system, whether that's through mindfulness, grounding techniques, breath work, etc. And if you are already in therapy or choose to seek a therapist after this conversation, the therapist can help you with all of these areas. Okay. Now there's lifestyle and holistic supports. So whether that is herbal remedies, teas, tinctures, aromatherapy, and diet changes. So I put caffeine here because I really wanted to point this out. I know a lot of people are not aware of this. I actually learned this a few years ago when my anxiety reared its ugly head back in 2020. Caffeine can increase anxiety. I'm gonna say that again. Caffeine can increase anxiety. Okay. And so if you are a person who constantly, drinks caffeinated beverages, whether it's soda, whether it is coffee, and you're like, I really have anxiety and I want to figure out why or how to manage it, the first thing you probably want to do is stop consuming caffeine, or at least limit it, right? There are options. Again, for me and caffeine, we don't go together. We are not friends. So in terms of coffee, but I love my coffee, right? So, and sometimes decaf just doesn't do it for me. So I looked into mushroom coffee, where there are even stuff on Amazon where I can get mushroom coffee that helps with focus energy and things like that. Okay. Then there's also medication. Now, medication is, like I mentioned before, not a one size fits all conversation. Medication is not necessarily a recommendation or for everyone or needed for everyone. Again, it just kind of depends on the person and your openness to taking medication. Okay, so there's anti-anxiety medication, and there's also these medications that are referred to SSRIs and SNRIs. So what are those? Really quickly, I'm not going to go into it too much, but SSRIs are selective serotonin reuptake inhibitors. And so what these do is that they help to increase the level of serotonin in the brain. So what's serotonin? Serotonin is a mood stabilizing neurotransmitter that our bodies create naturally, But sometimes we may have like a decrease in our serotonin, and so that can cause mental health concerns, whether it's depression, anxiety, things like that. And so we want to find ways to boost our serotonin. So medications can do that, but walking outside, having a healthy diet, deep breathing, calm breathing, sufficient sleep, these things can also help to increase your serotonin. But I will say that medication will help to increase it at higher rates, okay? Because medication is more of an intense type of way to cope or manage anxiety. Okay, and then we have SNRIs, which are serotonin norepinephrine reuptake inhibitors, which these help to elevate the serotonin and the norepinephrine in our brain. Okay, now if you ever want to or are interested in medication, the prescriber will be the one to make sure to educate you on, what is most suitable for you. Okay. Now, if a person, on the call, or if you know someone that is experiencing anxiety or has been experiencing anxiety, you may not be able to get that anxiety medication tonight, right? Or even tomorrow for that matter, or this weekend. So what can you do? Especially it's a 3-day weekend, right? So for some people, I'm still working on Monday. But for most people, there are other less invasive ways to manage our anxiety. So practical tools that you guys can use today. And please feel free to share this with anybody that you feel could benefit. So we have box breathing. So I'm pretty sure everyone is familiar with deep breathing, right? Inhale through the nose, exhale through the mouth, right? And so box breathing, we think about a box, right? We got the four sides. So we want to inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and then release. I'm sorry, pause. Give me a second. Again, it's the end of the week, so I'm a little tired. So we're going to do that again. We're going to run that back. We are going to inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and then pause for 4 seconds before doing that cycle again. Okay. Now, if anyone is doing that, I recommend that you do it no less than 10 times. And you want to do it slow, steady, and at a slow and steady pace to make sure that you're regulating that the heart palpitations, the difficulty breathing, the fast breathing. Okay. Another thing that you could potentially try is a grounding technique where you can name 5 things you see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Now, what do the 5 senses have to do with anything? So I mentioned mindfulness very, very briefly, maybe about 2 slides ago or the last slide. Being able to stay grounded in the present moment. So presently, what do you see? What do you feel? What do you hear? What do you smell? What do you taste? That can help to distract you from the anxiety and the catastrophizing or the what if thoughts or the spiral thinking or the cognitions or the whatever it is that you're experiencing. The grounding technique can have you focus on that grounding instead of the anxiety, instead of the amygdala. All right. This is kind of getting you back to that prefrontal cortex, that logic and that reason. Okay. Other grounding techniques, there's categories. So it's literally like, you can think of a category, types of cars, right? So we got Ford, we got Honda, we got Kia, we got Nissan, right? So you're literally just and I just picked cars as random, but what that's doing is, again, is having you focus on listing all the different types of cars, because you got to kind of think for a second, right? I could do a few, but it might take me a second to think about the other ones. And it's taking you away from thinking about those anxious thoughts. Okay. Counting backwards from 100 by increments of 7. Now, I don't know about y'all. I did very well in math, but I use a calculator for like most things that I do in life now. And so to think about intervals of 7 backwards, I'm gonna have to think about that, right? So again, just all of these grounding techniques, they basically help to kind of distract your mind away from the anxiety or anxious thoughts and on that specific grounding technique. Okay. Then we also have gentle exposure versus avoidance. So again, we are not avoiding. That is not what we're doing in 2026, in 2027, 2028, and beyond. We are not avoiding. Okay. We are going to gently expose ourselves to that anxiety provoking situation so that we can build our mental capacity, our physical capacity to deal with those anxiety provoking situations. Okay. Let's see. All right. When to seek help, when to say to myself, all right, you know what? I've been experiencing X, Y, and Z for this amount of time. It's time for me to actually speak to somebody about this. Like I mentioned before, when anxiety is interfering with work, school, relationships, whether that's romantic relationships, social relationships, family relationships, panic attacks, if you are experiencing panic attacks, and again, it's interfering with your life. If the avoidance is limiting your life, so maybe you're not going out to that outing that your friend invited you to, or to that family gathering, or to the movies, or whatever it is. And if your sleep is being disturbed because of the anxiety, if you're staying up all night because of your anxious thoughts. Who to seek help from? So anxiety supports. Now, you can definitely start with talking to your primary care physician, pediatrician, for if it's a minor, right? They can kind of help give some guidance. If you're looking for medication, PCPs can also prescribe some anxiety medication, so that's an option as well. But we also have therapy, right? So therapists and psychiatrists. Now, I wanted to provide a list of different platforms that people can look towards for finding therapists, because I find that a lot of people don't know where to start, right? So we have psychologytoday.com, growtherapy.com, we have ZocDoc, we have therapyforblackgirls.com. I will add a little disclaimer, Therapy for Black Men, for some reason, every time I go on that website, it's not active. So I'm not sure what the update or follow up with them is, but if it's male specific, we also still have Black Men Heal, which I actually used to contract with them some time ago. And they are a Philly-based company where they focus on, again, mental health for Black men. And they make sure that they hire or contract with therapists or mental health providers of color, because that's important for so many different reasons. Then we have online or hotlines and online resources. So we have the National Alliance on Mental Health Illness. We have Anxiety and Depression Association of America. And we have the Crisis Helpline 988. Now, for anyone who's not familiar with 988, it's like the mental health version of 911. Right. So like 911 is like if you have like a medical emergency, or it could be criminal, or, you know, some type of emergency in that way. 988 is specific to mental emergencies, mental health emergencies. Okay. So before I even ask this question, if anyone is, and please, by all means, you don't have to feel obligated to answer, but if anybody is using or has used any of these resources, so if they've spoken to their primary care physician about anxiety, or an anxiety assessment, or anxiety medication, or they've used one of these platforms like Psychology Today or Therapy for Black Girls to find a therapist, or you've contacted 988, drop a me in the chat. Again, if you don't feel like sharing, that's absolutely okay. But again, self-disclosure sometimes just is helpful to know that you're not alone. I can say that let's see. I've spoken to my primary care physician, yes. I'm on these platforms. So I'm on Psychology Today, I'm on Grow Therapy. I worked with Black Men Heal, so I necessarily didn't use those, but how did I find my therapist? Psychology Today. Actually, I found my therapist on psychologytoday.com, my current therapist. The last thing I forgot to mention is that you can also contact your insurance company, right? So if you're working with insurance, or if you want to use your insurance because we don't want to pay out of pocket, understandable. You can contact the number on the back of your insurance card, and they can either give you a list of mental health providers, either in your area or in your state, or they may direct you to their website where you can see that list. So if you want to stay in network, so you're only paying a copay, or, you know, getting it towards your deductible.
Well, can I say something really quick?
Yes, please.
When it comes to therapy, I'm a little bit biased because I've been going to therapy for like years now. And it's like, the more I get into therapy, and I think maybe it might be the place I go to. Over the years, it seems to be more transactional each time. Like, if my therapist gets changed, it's like it's not even about me. It's like about them getting like they how do you say it, like just like it's as if they got a list that they have to check off. It's never it's not as genuine as it was, like, a while back ago, like a while ago. So it's like the last therapy session I had, I just had to tell her, like, I don't have the urge to go there anymore because it doesn't seem genuine. It just seems like I'm talking to a wall that's agreeing with everything I say.
And I say for one that you like advocated for yourself in that way and said, honestly, I don't think this is for me. And that's okay, because no therapist should take that personally because it's not about us, even though that's what you experienced. You felt like they were making it about them and not enough about you. So if you left that place, it sounds like that was probably a good idea, right? Something that I find really important to do is like, if you are hiring, right, a therapist or any healthcare provider, and you feel like you're just a number on or an item on a checkbox, if you are just, money to them, a paycheck to them, if your voice is not being heard, please leave. like tell them, like, respectfully, I don't think this is, working out for me. I think I'm looking for something different. Thank you for your services. And you find somebody else. Because at
That
the end of
is
the
that is the thing. That's the thing about it. I know, I don't know if everybody can relate. I just know, between us and the group, I am
day,
on anxiety meds and depression medication. So
okay.
I tell my therapist, like, I'm obligated to come so I can get those medications. But like, I'm trying, she was trying to help. She was like, I'm advocating for you. I'm telling her that you don't think therapy is
Mm-hmm.
working, but you still want the medication. Because the medication honestly does more work for me than the therapist. You know what I'm
Therapy.
saying? Like,
Yeah.
it's loopy. It's like up and down. Like,
So sometimes that can happen in
I
regards
feel
to like,
I feel like when I go, I told her, I said, when I come here, I feel like I have more anxiety than when I walked in. Yeah,
that should never be the
it's just
case.
really not good right now with the
Yeah.
therapy.
So that sounds like that's just not a right fit for you. And I would definitely, if I could be honest, and no shade to this agency or the therapist or anything like that. Again, it's nothing personal. It's just not a good fit for you. So, and I will say that like finding the right therapist, it's tricky because it's work. I'll be honest with you guys, right? Like you have to send out, go on these directories, call your insurance company, contact them, send them emails, call them, leave voicemails. You got to wait for them to respond. Sometimes they don't. And that's something I've heard that actually really like frustrates me, is that I've heard from a lot of clients like, I reached out to such and such therapist and they never even responded. That bothers me. So I'll say that right now. But nonetheless, it's work, right? You might start therapy with someone. I remember, again, self-disclosure, I started therapy with someone maybe about 6, 7 years ago, maybe. And we had like 3 sessions. And I knew from the first session, I knew it wasn't for me. But I was like, you know what? I'm gonna give this woman a chance because I don't want to be too quick to write her off. I gave her 2 more sessions and then I ultimately realized, you know what, this is not for me. And that's okay. But I had to work to find another one. So it can be exhausting. It can be difficult, but there are a lot of things that can help to mitigate or help you find the right therapist faster, right? So I'm going to say this really quickly, and I do want to continue because there's a few more slides that I have, not a lot, and then we can kind of get into some other topics. So
And there are a couple of questions as well that I'll read out to you when you get finished
okay,
with the
yeah.
statement.
So when we get to the Q&A, I think we'll revisit that because I'm almost done with the presentation. I think I have actually one more slide after this.
Okay.
So let me say the statement. I'll do my next slide, and then we'll get to everyone's questions. Okay. So what was I going to mention? Now I'm losing my train of thought.
When you went to therapy
Therapist.
6 or 7 months ago, and then you was talking about the transition of switching, I think. Therapist.
Uh, yeah, I
6 or 7
apologize, guys.
years ago, you said.
Yeah, so I did find a new therapist for myself. But again, it is work to be able to find a therapist for yourself. It is an investment. It does take time. Oh, this is what I was going to say. Questions that you can ask or things that you can do to kind of assess from that first session if this is going to be a good potential fit for you or not. Okay. Asking the therapist, so what are your approaches to therapy? How do you work with your clients? Right? Because that's important. There's some therapists that they dominate the entire session, they talk the entire time. There's other session therapists where it's kind of like you said, it's like talking to a brick wall. You're talking the entire time and they're giving you no feedback. or the only thing they're saying, okay, mm. If that's all you're getting, you might want to find a different therapist, okay? If that works for you, hey, that works for you, right? Keep going. But if not, you might want to find a different therapist. So what's their approach? Do they, this isn't necessarily always needed, but do they connect with you, or do they find ways to connect with you to help foster your experience? So in terms of, again, like I use self-disclosure. Now I don't tell all my business, but I'll share certain things, right? To help lessen the gap of, because a lot of people can think, oh, a therapist is up here and I'm down here. No, we here. Because at the end of the day, I'm a human being as well, right? So can I use self-disclosure to help validate your experience? To
That's
help you feel,
oh,
to help you feel seen?
that's what I'm saying. Like, since I guess maybe the agency I'm in, the
Mm-hmm.
people that I see, it's like they start to leave. So the therapist has to get changed. My like
Oh, I get what you're saying.
yeah, there was a therapist that I related to on so many levels. It was perfect.
And she
And
left.
she in herself, she said, I have to go because it's like it became so many more rules for them. So that's even she was so
Yeah.
relatable. And she was white, but she was young though. But it was like
So
she always gave me advice. We always related on our stories and everything. Like I was so comfortable with her. And then to switch to somebody new that's just like not getting
it
it.
really disrupts the therapeutic process, and it can actually like discourage someone from like, well, damn, I got to start all over. Like, I don't want to do this, right? So I'm contemplating on if I want to say this or not, but I'm gonna say it because I feel like I'm a very client-centered therapist in terms of I care about the client needs. If I can be honest with you, I was one of those therapists where I've left agencies because I'm like the politics, the like they want me to, work with someone who has schizophrenia. I'm not trained in schizophrenia. Why you got me working with this client? That's not ethical. I gotta go. I gotta leave. But now what happens is the clients that I was working with, I can't work with them anymore. So again, their therapeutic process is disrupted, which is again part of the reason why I created core psychotherapy, because I wanted to make sure that I had a client-centered agency or a practice, and I'm not leaving. Like it's me. I'm the therapist, so I'm not gonna quit. I'm not gonna, right. It's me, right? So what I was trying to decide on whether I wanted to say or not is, if you've had that experience where you've gone to like a group agency where there's several therapists and you kind of just you get one selected for you, you might want to, it depends, okay, but you might
Ask.
want to see clear of those because the turnover is high, right? There are a lot of therapists, and on a therapist's end, you get caseloads are way more than we can handle. We're burnt out. It's politics. It's a lot of stuff. So people end up leaving. So to help minimize the chance of your therapist leaving or quitting or whatever the case, what can be helpful is more of like a potential solo practice. And by no means am I trying to promote myself or encourage everybody to see me, but just any person that is, I don't want to say only solo practices, but just be wary of group practices. Is basically the point that I want to make. Okay, so I do want to get to my last slide really quickly, and then I'll get to the slide of the Q&A, and then any other questions that have come up or any of the comments or anything like that we can get to. Okay. So again, we're just talking about anxiety supports and resources and how to manage and cope with anxiety. Another piece that I did not get to, we spoke about the medication, but there's also holistic and herbal ways to address mental health and particularly anxiety. And so again, the name of my practice is Core Psychotherapy. And so quick just story about why core, what does the word core have to do with anything? So I was struggling to come up with a practice name. I'm very bad with that. Even in school, when they were like, come up with a group name, I could never do it. But so and this was before ChatGPT was an AI was as big as it is. So it really took me a while to come up with this. But I thought about, when you go to therapy, when you have mental health concerns, you really want to get to the root, the core of what's happening, right? You don't want to say, okay, well, I got into an argument with this loved one, and I'm stressed because of that. Well, why did you get into that argument? Oh, well, it was actually because you were experiencing da 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 da. Right? So we want to get to the core. So that's kind of where core psychotherapy came. And so I actually have, again, in addition to providing therapy, I also have a certification in herbalism, because I saw a lot of clients did not want to necessarily take medication to address their mental health needs. Understandably so, sometimes side effects and things of that nature. And so I took it upon myself to educate myself on herbal remedies to take care of your mental health. And if I could be, again, self-disclosure, I too try to stay away from medication for medical and mental health needs, just to go more of a natural route. That's just a personal preference of mine. And so my core store, which is available on my website, we have herbal teas. So I have the core calm tea, which is more so for anxiety. There's the core comfort tea, which is more so for emotional dysregulation, discomfort during the menstrual cycle. So this is more for my women, my ladies. Okay. Then I have herbal tinctures. So we have the core calm tincture, which is similar to the tea. It helps with relieving anxiety. It helps promoting a sense of calm. And then I have the core clarity tincture, which this one focuses more on mental clarity, focus, again, non-caffeinated. So we want energy, we want focus, we want non-caffeinated, because that's going to potentially increase your anxiety. Okay. I also have essential oil roller balls. And so I have again, you'll see the theme, core is in every name, core, calm, clarity. These names are running themes for my products. But I have the core calm roller ball. And so that one is lavender. So it, again, helps to promote a sense of calm. And there's the core clarity roller ball, which kind of helps with focus. And so the roller balls are more of an external way for herbalism, whereas the teas and the tinctures are more internal. And then the last product that I have, at least for right now, who knows what'll happen in 2026, I might come out with more products. But I also have an category called cognitive distortions, right? So irrational ways of thinking is basically what that is. And so there's a whole list of the cognitive distortions and how to combat those. There's self-care tips. There is mindfulness activities. There are, like, if you're in therapy, there's a section for therapy notes. So if something resonated with you in your therapy, like, yeah, my therapist, she hit on something, you want to write it down. There's a therapy section. So it's, 90 to 95 pages. That the journal is in transition right now. Actually will share with you guys that I'm working on. It's currently an e-journal, but I'm working on getting physical copies. So that's a big thing for me. So I'm working on that. I will say, if you want to know when that journal will become physical and available for purchase, you can sign up for my email list, where I will be sending out information on launches for new products and new items and updates about the journal. Okay. And that is all that I have for you guys. So this page, really quickly before we get to the questions, has my email and my website. The QR code that is there, that is the QR code for my website. Now, if anybody is on like a laptop, you can just take a picture to the QR code. If you are on a mobile device, you can take a screenshot of this page right here. And then when you go back into the picture, you can click on the QR code and that'll bring you directly to my website. I've heard a lot of people say, well, why are there QR codes when I'm on my phone? I can't take a picture of the QR code. So you take a screenshot, and then when you go back into your photos, you can click on the QR code and that link will pop up. And then if anybody did want to follow me on social media, so I'm, I guess, the most active, I guess, on TikTok and Instagram. The handle is @core_psychotherapy. And again, if anybody is interested in any tips, mental health tools, resources, updates on products, or updates about my practice, or any special offers, you can sign up for my email list, which is the website link /contact. And that is all that I have for everyone. So I'm going to stop sharing so I can get back to the Zoom and I can see the questions, and we can get into the rest of this presentation. All right, so there's probably a lot of stuff going on. So I don't know if someone else can read the questions for me because I'm probably gonna lose everything.
Yes, absolutely, absolutely. So one of the questions that came up, first of all, thank you, Renee, for your presentation today, everyone. It was
Amazing.
very
Thank you,
informative
thank
and
you.
very helpful. And we do have some questions. So if you guys have additional questions, you can put them in the chat. But I'm just going to scroll up to some of the other questions that you guys asked earlier. I know one of the questions that I've seen asked, are you taking clients in Massachusetts?
Oh, in Massachusetts. No, I do apologize. So currently I am licensed in New York because I'm born and raised Bronx, New York. So I had to keep that license, and in Maryland because I currently reside in Maryland. I am potentially I did have a license in Virginia that I let expire last year. I may get that back this year. Again, if you sign up for the email list, you can find out updates about, updates like that. There is something, and I don't want to speak too much about it, but for social workers, right? For social work, I'm technically a social worker therapist, synonymous, same thing, or can be the same thing. There's something coming out hopefully soon called the Social Work Compact. So basically what that means is that it will allow social workers and therapists to practice across more state lines without all of the politics and the issues. And it's been difficult for therapists to practice across several state lines. It's a lot of stuff we got to keep up with. So this is going to help to streamline it. So I'm hoping that gets released. I don't know, within the next year or two, I don't know. So fingers crossed. But unfortunately, no, not for Massachusetts. I apologize.
Okay. No worries. And if you guys just stay, we have a couple other things. So we're going to do questions. We have a quick activity, and then we'll talk about the evaluation. So one of the other questions, going back to the anxiety questions, what would you say are any downfalls of taking medication? What are any negatives to taking medication?
So good
The
question.
downside is the word.
So I will preface this by saying that I am not a psychiatric provider. Okay. So I do not have a background in psychiatry. I can only speak towards what I have been informed of over the years as a therapist. Okay.
Mhm.
So a couple of things. Yes, there are potential side effects to medication, right? And I will be transparent and say that there could be potential side effects to herbal remedies as well. I actually had another webinar about this last week. Herbal remedies or prescription medication for your mental health needs, which one is best suited for you, but to be aware of the benefits, but also the potential downsides, the side effects. So potential side effects. And again, if you meet with a psychiatric provider, they can speak more towards this, but there could be potential side effects. Cost depending on insurance or whatever your financial situation is. Some people may only have a low cost for getting their medication, so that might not be a concern for them, but some people might not have insurance, and so sometimes these medications may cost upwards to $100+, right? So cost can be a potential issue. If I can be honest, and I believe that and please forgive me because I'm still getting more so acclimated with the group, the healing table. But I believe
Right.
one of you ladies is a nurse practitioner, so
Yes,
you might be
right.
able
She's
to
a
actually
doctor.
Yeah.
answer the question a
Yes.
little
So I
bit
was
better than I can.
right. I was
Mhm.
gonna call her. I was gonna call her up next to find out what her perspective is. As a therapist myself, I have clients who do take medication, and it has been very beneficial to the ones that I know that do take the medication. Very, very beneficial, very calming. And then, of course, it depends on the levels, right? So some people need things different than others, right? So it's not a one size fit all,
Right.
but there can definitely be side effects just based on your individual body, right? So Willa is
Here.
right. So Willa prescribes medication. What would you say, Willa, is one of the challenges or downsides of medication, if any, from your perspective?
Well, let me say first, thank you so much, Renee. I really enjoyed the presentation. I think
Of
you did a
course.
wonderful job, and I love herbal medication. I signed up for a herbal class, but I just was in over my head. I still have the book from the class. I admire that. I've always loved herbal medicine. As far as medication, uh, I always think there's a place for medication if people are going to take the medication properly. And evidence base shows that there's a better chance of 100% efficacy if medication is combined with therapy. You understand? So that while you're processing these things, the traumas that have caused the anxiety, like one of the ladies said, you're taking medication so that you can move through these things without having the panic, without it crippling your quality of life. So you're taking the medication, but you're going through therapy and you're learning positive coping skills to deal with those things. So I think it's a combination that makes you have a better quality of life.
Yeah, and I would absolutely agree to that. I will also add that therapy, medication, they're voluntary, right? So by no means should anybody feel obligated to take medication. But like Lakeisha mentioned, I too have seen a lot of clients that have seen a lot of benefit from taking medication, whether it's for anxiety, if it's for ADHD or what have you. And so again, it just depends on the individual need, but you want to make sure that you are working with a provider, one that kind of like we spoke about a little bit a few minutes ago, that is going to hear you, that doesn't just feel like you're just talking to a blank wall. They're just like, okay, well, take this med and I'll see you in a month, right? They're really going to ask, okay, what have you been experiencing? Has anything changed? Let's talk about, do we want to talk about increasing or decreasing your dosage, right? Another thing I want to say about medication is that a lot of people think that, and this is something I spoke about during the webinar last week, a lot of people think, well, if I take medication, I'm going to be on medication for the rest of my life. That's not true, right? And again, it's person dependent because there may be some people who may need to rely on medication. And this is may be more of if we're looking at other diagnoses like psychosis, right? Psychiatric disorders, not psychiatric disorders, psychosis, like hallucinations, or a little bit more severe cases. But when it comes to anxiety, how I like to look at it is this is the process, right? You start with a therapist. You see that therapist, you start working with them for a little bit. That therapist is feeling and getting a clinical impression that just talk therapy alone is not enough, right? That your daily functioning has not been improving. That therapist may then recommend or suggest a psychiatric referral to see a prescriber for medication. Now, if you agree, again, because it's voluntary, they may provide you with resources so you can see a psychiatric provider. Then you will potentially start a medication while you're still doing the therapy. Again, they work in tandem. You're working your whatever dosage may need to happen over time happens over time. And as the medication is helping to increase your ability to function in life and receive the information and the work that you're getting in therapy, now you're going to start to wean off of that medication. And that means if you're starting at 50 milligrams of medication, you're going to go down to 25, or you're going to go down to 10. I don't know what the increments are. Again, I'm not a prescriber, but you're going to start to go down. And eventually you're going to stop that medication. But that entire time, you're still doing the therapy. Then eventually, even after seeing the therapist after some time, you stop the medication. Now you're functioning very much so adequately in life, and you can potentially stop the therapy as well. So again, neither one need to be lifelong processes.
And thank you for bringing that up because that was actually a question that Chris asked. Do you outgrow anxiety? So thank you very much for sharing that.
So I will add to that, and I don't want to sound like I'm being pessimistic or anything like that. I like to be very transparent. There's no like cure for anxiety. You can't cure it. But what you do is you learn how to better manage it. Right. So I'll give you again, self-disclosure, personal example. When my anxiety or panic attacks first started, right, I would experience them for upwards to about 45 minutes to an hour. Right. That was maybe about like when they really, really started. This was like maybe 2020. So really not even that long ago, if you think about it. And now I've gotten them down. They don't really happen that often, but when they do happen, I've gotten them down to a couple of seconds. So it's not interfering with my ability to work, to socialize, to do the things that I need to do, right? So it's improving management of anxiety. It's not like you'll never feel anxious ever again. Like I mentioned in one of the first slides, we all experience anxiety to some level. It's just making sure that it's not negatively interfering with your ability to function in your day-to-day. So I want to say that piece.
I'd like to ask a question. Um, Lakeisha, do we have other questions? Because I can wait.
Nope. No, I don't have any other questions. And if you guys do have questions, please put them in the chat so we can make sure we get them answered before we go on to the next part.
So I too want to say thank you so much for that presentation. A lot of information, a lot of very useful information. And so I'm wondering, so if anxiety is not something that can be cured, but can be managed, then I'm thinking about, so did I hear you say it's a matter of rewiring the brain or like cutting it off at the pass before it becomes too overwhelming? Um, and for people who have yeah, I think I just would like to stress the point that if you can cut it off before it takes over, then you're much more likely to be able to manage it. So you don't have to be afraid to go out or afraid to drive your car if it's that's a trigger. Can you speak to that for a moment?
Yeah, absolutely. So what's helpful is self-awareness, right? And self-awareness is helpful in all aspects of life. But for this conversation, you want to be aware of what your triggers are, right? So if you know that crowds tend to be a trigger for you, and you have to, I remember I had a client a few years ago, sweet girl, middle school. It was a middle high school. So like she was like on the smaller end, her size, right? She was small. She was sixth, seventh grade, but she was also in school with these tall 12th grade boys, beards, voices all deep, right? So and the crowds and kids sometimes fighting and things like that. And so she just like stopped going to school, right? So that's a whole nother situation. But the point that I'm trying to make with bringing up this example is that if you know that crowds tend to be a trigger for you, you want to do whatever you can before you get into that crowd to mentally prepare for that, mentally, physically, spiritually, even if needed, right? So you want to have self-awareness first of what those triggers are. So is it social? Is it crowds? Is it confrontation? Is it, I have another client right now. She's always anxious at work, imposter syndrome. Am I doing the right thing? Am I performing correctly or adequately? So she's always anxious at work. So maybe we spoke about this. Her morning routine has to include something that's going to help to already from the jump mitigate some of that anxiety as she goes into the workday. So she can function a little bit better, right? So again, you want to focus on self-awareness. Another piece after being self-aware, again, is being able to have the tools that help for you. Now, tools, coping skills, resources, like I've mentioned before, are not one size fit all types of situations. Now, for me, I know that aromatherapy was very helpful for me. Lavender oil, we were like this once upon a time. Again, my anxiety hasn't been as bad since, but being able to inhale or smell lavender oils, roll them on my temples, that was helpful for me, right? Whereas I know some people, that's not helpful for them, and that's okay. But you got to find what is helpful for you. So whether that's listening to music, if that is, going for a walk, if that is, there's something with, I didn't mention this before in terms of grounding techniques, temperatures in terms of hot or cold, right? So what I usually like to say to clients is, so if you are experiencing anxiety, you're up here, you're anxious, you're overwhelmed, you're heightened, you want to get something warm that's going to kind of bring you down. Kind of like a tea, hot chocolate, a heated blanket, right? You kind of want to like it brings you down, right? Kind of not brings you down in like a negative way, but it like calms you down. It makes you feel like a hot shower, right? So some type of warmth. What I usually say on the opposite end is if there is someone who's feeling like depressed, if they're feeling down, like emotionally down, you might want cold because cold is gonna wake you up, right? So splash some cold water on your face, a cold drink, cold coffee or cold water. People do like those, I could never, but those like cold plunges, like those like ones where people go to the beach and they just jump into cold water or whatever it is. Right, that's going to wake you up. So again, if you are feeling down mentally, get something cold that can kind of wake you up and bring you up, give you a little bit of energy. And if you're up already, you're escalated, you're heightened, get something that's warm that can kind of mellow you out, calm you down a little bit.
Thank you.
Okay, so I hope that answers the question.
I'm wondering if there are things that people do online that works for them.
Absolutely. So, everything's online these days. You know what I mean? So whether that is Okay, so I was going to say whether that is going on YouTube. So if you want to look up mindfulness activities, meditation activities, guided meditation on YouTube, right? I will say I'm cautious of social media because I've seen, again, a lot of miseducation on social media. And I've seen a lot of people that have no business, or maybe have no business speaking on mental health topics, And then it becomes, it goes viral, and then that becomes the rule of thumb for everybody. So if you are going to use social media for your mental health needs, check the credentials. Like, we got to normalize that too. Like, I usually don't go to a doctor, a hairstylist, I'm getting my hair done, my nail tech, whoever it is. I need to see your certification. Like, I need to see that you went to school for this, that you got a degree, that you got a certificate, that you got a license, to know that you know what you're talking about. Right? Don't just let, this influencer or that person give you tips on mental health if they're not a mental health professional. Same goes for medical health. Same goes for physical health, the gym. That's another thing. I've been seeing people teaching people how to, do your squats like this, do your form like that, but you have no certification. So again, we want to make sure to check people's certifications and qualifications. So again, social media, to an extent, YouTube. There are also a lot of websites. I can't necessarily think of specific ones off the top of my head because there are a lot, but there are a lot of websites that have like worksheets, free worksheets for people's disposal. I'll actually share one with you guys that I've been using quite a bit with some of my clients. Let me make sure I get it correct. One second. I believe it's called takingtheescalator.com. Let me double check. Yes, takingtheescalator.com. I will actually put the link in the chat because I had it up. I keep the tab open because I often use it with a lot of my clients. So this website, and I already have the specific link to the worksheets page, it has a long list of free worksheets that people can use for various topics. So even just looking at it, there's a whole anxiety section, there's anger management, there's addiction and the brain. It goes alphabetically. There's coping skills, change, commitment, communication, boundaries, coping skills, defense mechanisms, depression, and the list goes on. So there's several different, and a lot of them some of them are like educational, like something to read, while others are like worksheets where you can actually go in and they ask questions. So it's helpful that way.
Okay, wonderful. Thank you. Listen, and for those people in the audience, like in this community, are there things that you've done that work well for you that you'd like to share before we move to the next slide?
Hi, hi, this is Janelle. There's a website called Stop Panic and Anxiety, and it's by Excel. And I couldn't even believe that this actual app, you can download it if you got an Android phone, you can download it on your Android phone. And if you got an Apple phone, you can download it from Google. And I can't even believe that this app is free because it's like 3 months worth of work, from anxiety to depression to reflections, also to working on relationships, coping skills. It's an excellent, excellent app. And
you said it's called Stop Panic Anxiety?
Yes, she actually talks you out of a panic attack. And
Wow.
yes, yes. And I'm a person myself who suffers from panic disorder. And I'm telling you, this is an excellent, excellent app. It's called Stop Panic and Anxiety. It's by Excel.
I'm actually going to look that up. One for myself, but also for my
Yeah,
clients.
you can listen to it in your car, and then also too, she has a lot of guided imagery on there.
Okay.
Awesome.
Wow.
Yeah,
Thank you
and
so
so
much for
like I
that.
mentioned before, the five senses, I find focusing or using coping skills or ways to manage your anxiety by using the five senses are often helpful. So like guided imagery you mentioned, right? So imagery is sight, right? I mentioned teas, right? That's taste. Aromatherapy, that smells, right? So different things that can connect to the five senses is helpful. So thank you for sharing that.
Yeah.
See,
Thank
you don't know what you don't know. That's why I never act like I'm above any other person, because I never heard of this and I'm about to look it up. Probably tomorrow.
This community is really designed for us to learn with and from each other. That's why we're here.
Mhm.
And so people are sitting on gems they might not even be aware of. But before we go to the next slide, I just think that there were so many things that have been shared and so many things that people can do to kind of um,
Manage.
learn to manage, right? And it's, yeah, a lot of resources. So let's move to the next slide. If there were no other comments or reflections, thank you, Vanessa, for sharing that.
And again, we just want to thank Renee for joining us today and speaking and sharing
Absolutely.
and answering all your questions. And we also want to thank you, everyone, each one of you, for being present and attentive. But we are not done. We do have our January intention, so we will do that now. Let me just get to that slide. Okay. So for this part of our learning collaborative, what I really want us to do, the reality is that we have learned a ton today. We have a lot of information today. We have some tools. We understand the symptoms better. And so we want to use this time for us to reset, right? And take some time. We're going to do a quick breathing, and then I'm going to ask everyone to follow along as we talk or as I go through the intention for this month. So what this means is I'm going to run you through a quick breathing activity, and then if you will, close your eyes. You can turn your screen off or whatever it is. But to yourself, I want you to repeat the intention and kind of set yourself for the rest of this month. Does that make sense? Any
Yes.
questions about that? As I said, I need some feedback. Yes, if you understand, if it makes
Yes.
sense, please put a 1 in the chat. Okay.
Mhm.
Um, Renee is great. She could go. I need feedback, y'all. So if you
Yeah.
hearing the words that I'm saying and you are on board, thank you. Thank you, Ashley, Sydney, the iPhone, Tatiana. Thank you for
Mhm.
responding. There's about 28 of y'all in here. So
And Lakeisha, the intention is, whatever you're doing, you want to practice it, you want to be intentional and deliberate. And that means doing a little bit every single day. And so the intention is something that you can copy and repeat every single day, multiple times a day. It's what works for you.
okay. All right. So if you will, I need to see it. If you will, close your eyes, look down or look away. But I want you to take a deep breath in. And as you take that deep breath in, I want you to imagine positive energy entering into your body. So, and I'm going to count. So I want you to breathe in slowly for 10 seconds. And as I count, I want you to hold it, and I will tell you when you need to release it. Okay?
Mhm.
This is a purpose-driven time for you to recenter, reset, and then you can also practice. All right, so we're going to take a deep breath in for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and hold. And then we're going to breathe out for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, don't feel some kind of way if you didn't get to 10. Most people don't, right? But the goal is for you to be intentional and be mindful of your breathing and learning how to slow your breathing down. So we will do this again. And this time when you breathe in, you are pulling in positive energy. And as you blow out, I want you to actually visualize any negative energy, any anxiety, any discomfort leaving your body physically. Okay.
Mhm.
All right. So you're going to breathe in for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and hold. And breathe out of your mouth for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is also very good because it allows you to get oxygen to your brain, helps to slow your thoughts down. And I'm going to say the words, and you can say them to yourself. As I step into this new year, I honor my journey and the strength it has taken me to get here. I give myself permission to begin again, gently, intentionally, and without judgment. I recognize that healing is not a destination, but a sacred, ongoing practice. With each breath, I choose awareness over avoidance, compassion over criticism, and hope over fear. This is my intention. And I want you to close with taking one more deep breath again. As you are breathing in, if you are visualizing positive energy moving into your body, and as you exhale, you are visualizing any negative discomfort leaving your body. So I will count again for breathe in, for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and exhale for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you yawn, that is a good thing. It is an indicator that oxygen is entering into your brain, right? You're giving yourself space. Look at the yarns for the few people who have their awesome. Thank you very much for participating in that with us.
All right.
We have just a few more slides, I think, too.
All right. So,
All right. I want to go ahead and reiterate and say thank you again so much. We know that you could have been doing anything with your time, but you chose to share with us, and we really appreciate you. Next month's topic will be depression. We'd like you to have a beautiful night because you deserve it. All right. We have a QR code and a link attached to it to give us an evaluation. Let us know how we did tonight. Okay. And again, thank you for coming in. Ladies, y'all have any wrapping up words? Any closing words or thoughts?
Yes, for people who are not aware, just take a picture of the this QR code with your phone, and the question, the evaluation will come up. It's just 5 questions. And we would really appreciate it if you would take the time to fill this out, because it tells us what you're most interested in, or or your takeaway. So just take a picture with your phone, and you can answer the questions right there on your phone.
All right, then. Good night, everyone. Thank you so much.
Thank you so
Good
much.
night,
Appreciate it.
everyone.
thank
Good
you.
night.
Good night.
Please do the evaluation.
Please, yes. It's only 5 brief questions.
Super brief.
Yes. do we have the date for February?
Yes, February 12th, I believe.
All right, cool. Thank you, and have a nice evening.
Bye, everyone.
Good
Good
night,
night.
everybody.
Good night.
Thank you for coming.
Right.
Let me stop the recording.
Renee, thank you. You did